I'm sorry for what you're having to deal with at this time and for what your loved one is going through. We're going to try to help you. The following video simply goes over the required items that are needed for your loved one to be able to apply for residency, short-term or long-term, at a skilled nursing facility. These items have to come from your doctor or a nurse practitioner. First of all, we need orders to admit to a skilled nursing facility. This is not optional. We have to have this legally to be able to admit anybody into a skilled nursing facility. Secondly, we also need a face sheet. A face sheet simply is a sheet that has demographics about your loved one, gives us the correct names and contact information of your loved ones and those that need to be kept up to date on things. And it gives us information so that we can check on their insurance and what type payers that they have. We're also going to need some recent notes from a clinician, your doctor, nurse practitioner, whatever the case may be, so that we can evaluate our ability to see if we can meet the needs that your loved one has. And then we're going to need orders about their diet, orders that tell us what their diet consists of, what the consistency is in their food, and allergies and things like that for your loved one's own safety. We're also going to need an H&P. What's an H&P? Very simply, that's a history and physical, and your doctor will know what that is. We have to have one within the last 30 days. Now that may mean that you've got to schedule an appointment with your doctor or a nurse practitioner to get that. If they're comfortable with it, they can take an old one and they can date it today's date and write in no changes, and that will work also. We need a list of the current medications that your loved one is on from the doctor, and it also needs to say continue with current medications. That's an order that allows us to give those medications. We also need the code status. Is your loved one, do they have a DNR, a do not resuscitate order, or do they not? This has to be provided by a doctor or a nurse practitioner before anything can happen. Once we get all of that, then we go through it and our facility determines if they can accept this patient. And we do that from the supplied documents, or they will call us and ask us to get other documents so that they can understand what's going on with your loved one. Secondly, you've got to have financial acceptance. That most usually comes from insurance, either Medicare or Medicaid, or there is the option for private pay, though it is very expensive. There is also a third option called Medicaid pending. Now, I will do an addition to this video that will explain what those three are in more details. But if you have insurance, we have to check and see if it is Blue Cross Blue Shield, Humana, Presbyterian, or any of the others. And if it's any of those, we call that a managed care system. And in order to be able to admit a patient and have your insurance pay for it, we have to send documentation to your insurance company, who then reviews it, and they decide if that patient fits the status to be able to go into a nursing home, and they will pay for it. And that usually takes anywhere between 1 to 3 days, although sometimes it can take longer. If you have traditional Medicare, then it is required that your loved one has had 3 consecutive midnights as inpatient in a hospital within the last 30 days before they will allow them to admit into a skilled nursing facility that they will pay for. We also have to have an item called a PASRR, a PASRR, which simply stands for a pre-admission screening and resident review. This is required as a federal mandate for all applicants to Medicaid certified nursing facilities, and they're screened for mental illnesses, for intellectual disabilities, things like that, to make sure they're getting the type care that they need to get. Again, it's for the loved one's safety and appropriate care. Now, understand the provider can help you with all of this. Now with the PASRR, they may be familiar with that or they may not. And if they're not, your facility will be able to help you with that. So that might sound overwhelming. Please understand your doctor will know what these things mean. And your facility admissions director, liaison, representative, whatever your facility is using, will be able to orchestrate all of this once you get the ball rolling. And you do that by contacting your doctor or nurse practitioner and letting them know these items are needed and they need to get them to us. Again, we're going to need orders to admit to a skilled nursing facility. We're going to need a face sheet, recent notes, diet orders, a history and physical within the last 30 days, a current medication list with orders to continue those medication, and a code status. This has to be done by a doctor or a nurse practitioner. If you need more information on accessing care for your loved one, we will have some videos up on a lot of different topics that you'll want to know about. So simply hit the like, the subscribe, or the bell here so that you are kept updated whenever we get those on the website for you. Again, thank you, and please know that you're not alone. Thanks.